So this meeting of the Rotary University Board of Regents is called to order. First on our agenda today is Dr. Jones. As you may know, Dr. Jones, professor of anthropology, has been on the staff since 1987, and in 2012 was appointed head of the epidemiology department. We're familiar with his exploits in far reaches of the world. Dr. Jones is pursuing our continued funding for excursions into even more primitive areas of the world in hopes of immunizing all the world's children against polio. We have funded this for years, and progress has been remarkable, but eradication is still an incredulous and lofty dream. Professor Jones, the floor is yours.
Thank you. I'd like to thank the Board of Regents for your kind attention, and special thanks to Chancellor Mulcrone for allowing me this opportunity to address the need to renew this institution's award and commitment to this non-educational imperative, the complete eradication of polio. Dr. Virginia Chambers and I, in the early days, I have staked years of my life moral imperative to eradicate polio, but polio goes back much, much further. And if I may, I think it's important to revisit the historical context of polio, which is a viral infection of the spinal cord that targets motor nerves. Polio has plagued man since the early Egyptian times. We know this from Roma the doorkeeper, dating back to 1403 BC. Roma is an upright decorated stone, frequently used as a funerary monument. Ancient Egyptian art tends to be very formulaic, with little variety or individuality amongst the figures. Grid patterns were used to ensure that proportions remained consistent, even when the scale was exaggerated. This stele, then, is rather unusual in its depiction of a man with a withered leg, a clear deformity characteristic of polio. Interestingly, this is not the only example of Egyptian art where a figure shows these characteristics. A painting from the tomb of Usurat and references to the condition causing the abnormalities in the body of King Siptah of Dynasty 19 all point to polio. Siptah was only a child of 10 or 11 years old when he assumed power. A medical examination of his mummy reveals that the king was about 16 years old at the time of death. 1.6 meters tall, he had curly reddish brown hair, and he had a pronounced deformed left foot, likely poliomyelitis. 480 BC, this Greece Attic Palique vase, imported into Etruria, which is ancient central Italy, depicts the mythical rendezvous between Heracles and Garrus. Garrus, the personification of old age, is helping himself with a stick. The high degree of realism of this artwork allows one to identify extensive lower limb muscular atrophy and an unnatural eye-catching scoliotic spinal deformity, while previously considered, prudently yet perhaps too hurriedly, to be a depiction of senile emaciation and pulmonary emphysema. The characteristically vivid clinical association leads us to hypothesize that Garrus's anatomical figures are compatible with those of a polio survivor, exhibiting the incapacitating and long-term outcomes of the spinal form of paralytic poliomyelitis. It is theorized that Roman Emperor Claudius of 54 AD was stricken as a child, and this caused him to walk with a limp for the rest of his life. Perhaps the earliest recorded case of poliomyelitis is that of Sir Walter Scott. In 1773, Scott was said to have developed, quote, a teething fever, which deprived him of the power of his right leg. At the time, polio was not known to medicine. A retrospective diagnosis of polio is strong due to the detailed account Scott later made and the resultant lameness of his right leg, which had an important effect upon his life and his writings. In 1789, Michael Underwood, a pediatrician in London, published the first clear depiction of a paralytic disease of infants in medical textbook. In the early 19th century, small groups of polio-afflicted patients began to be reported in the medical literature, but still only as sporadic cases. Underwood wrote, Quote, the disorder intended here is not noticed by any medical writer within the compass of my reading, nor is it so described as to ascertain the disease. It seems to occur seldomer in London than in some other parts, nor am I enough acquainted with it to be fully satisfied either in regard to the true cause of the disease, and I have never had the opportunity of examining the body of any child who has died of this complaint. I shall therefore only describe its symptoms in order to induce other practitioners to pay attention to it. End quote. Underwood then describes, quote, the debility of the lower extremities, which gradually become more infirm and after a few weeks are unable to support the body, end quote. In 1868, the first epidemics appeared in 14 cases in Oslo, Norway, and of 13 cases in Sweden in 1881. About the same time, the idea began to be suggested that the sporadic cases of infantile paralysis might actually be contagious. The next significant epidemic was 10 times larger than the previous outbreaks, with 132 recognized cases in Vermont in 1894. During an epidemic of 1,031 cases in Sweden in 1905, Ivor Wickman recognized that patients with non-paralytic, which is asymptomatic disease, could spread the virus. In other words, those people who were carrying the virus did not have outward signs, asymptomatic, they could be carriers of the disease, and they could spread it. The polio virus itself was discovered in 1908 by Viennese immunologist and future Nobel Prize winner Karl Landsteiner. The existence of telltale antibodies specific to the virus circulating in the blood of infected persons was discovered just 2 years later. During an epidemic of 3,840 cases in Sweden in 1911, Carl Kling and colleagues in Stockholm recovered the virus from healthy, which is asymptomatic carriers, as well as paralytic patients. In studying several fatal cases from the same outbreak, Kling found the virus in the victims' throats and also in the tissues of their small intestines. In 1931, 2 Australian researchers, Frank McFarlane Burnett and Jean McNamara, using immunologic techniques, were able to identify the different serotypes of poliovirus. They were aptly named type 1, type 2, and type 3. She and Burnett demonstrated that there was more than one strain of the virus, a fact that would later become very important in the development of the Salk vaccine. Burnett would later receive a Nobel Peace Prize in 1960. During the second decade of the 20th century, it became apparent that far more people were being rendered immune to polio by previous asymptomatic infections than were being immunized by recovery from the overt disease. By then, polio was well on its way to becoming a widely feared periodic phenomenon. In the 1940s and early 50s, Western Europe and North America lived through summertime terrors brought about by nearly annual polio epidemics. In 1952, approximately 21,000 cases of paralytic polio were recorded. As outbreaks were concentrated in the summer and early autumn, children were kept away from swimming pools, movie theaters, and other crowded places where they might be exposed to the dreaded disease. Outbreaks were widely reported in the press, and polio victims were encased in iron lungs used to help their paralyzed breathing apparatus. They were often displayed in public places such as department stores to encourage donations to combat the disease. Whether our own US President Franklin Delano Roosevelt suffered from polio or Guillain-Barré syndrome, it is inconsequential in that he advanced our ability to prevent polio through funding. That funding had a great impact upon research into infantile paralysis, which led to the discovery of the vaccines by Dr. Jonas Salk and Dr. Albert Sabin in the 1950s. But medical research and practice have had their difficulties even as it relates to polio. One of these is the Cutter incident. In 1954, Bernice Eddy, our hero of the National Institutes of Health, performed safety tests on inactivated polio vaccines developed by Jonas Salk for Cutter Laboratories. Now, Salk's inactivated polio vaccine was a killed virus vaccine. but Bernice and her team discovered that a batch of Cutter Laboratories vaccine contained residual live polio virus. 3 of the batches paralyzed the monkeys and therefore contained live polio virus. These findings pointed to a flawed vaccine manufacturing process at Cutter. Eddie reported her findings, but was ignored. And she was replaced by the head of the Laboratory of Biologics Control, William Workman. The identified problems with the vaccine were not passed down to the licensing committee. The flawed vaccine was licensed to the public. 40,000 children developed minor polio. 113 were paralyzed and 5 died. On April 29th, 1955, William Seabrough, the director of the National Institutes of Health, chaired a meeting to examine Cutter's manufacturing protocols. The meeting was also attended by Eddie, but produced no conclusion on what Cutter should do differently in its manufacturing process. On May 6, 1955, the National Institutes of Health Associate Director, Leonard Shield, announced to the press that the national polio vaccination program would be postponed until further notice. Vaccine manufacturers then withheld 3.9 million doses of polio vaccine. The polio vaccine program suspension in the United States was followed by suspension of similar programs in Great Britain, Sweden, West Germany, and South Africa. The Cutter incident was one of the worst pharmaceutical disasters in U.S. history, and it exposed several thousand children to live polio virus on vaccination. The Secretary of Health, Education, and Welfare, Oveta Culp-Hoppe, stepped down. Seabrough, the Director of Institutes of Health, resigned. Nevertheless, one might have thought that the world would be rid of polio after the discovery of these 2 cheap and effective vaccines by Dr. Salk and Dr. Sabin. But the fact of the matter is that small-minded people lack the vision and the will necessary to realize that this is simply a geopolitical problem to resolve. In 1985, 30 years after the vaccines, there were still 387,000 cases in 125 countries. And the World Health Organization expected that to continue as endemic, which is, as you may know, common, normal, and expected in a given population. One of the greatest partners to come along has been Rotary International. Their commitment since 1985 has been unwavering. Many consider Rotary to be the key catalyst in the success over polio that we now enjoy. And it's been no small task to bring together the partners of World Health Organization, the Centers for Disease Control, UNICEF, Global Alliance for Vaccine and Immunization, the Bill and Melinda Gates Foundation, and nearly every government of every country in the world. It's now known as the Global Polio Eradication Initiative. It's believed to be the greatest public-private healthcare initiative in the history of man. In 2023, last year, we had 12 cases in 2 countries, Pakistan and Afghanistan. And it's a reminder that we must continue our funding and effort to immunize all children. It is only through focus in distributing this serum that complete eradication can occur. In 2022, 10 of our esteemed colleagues in the scientific community drafted a declaration to stress the urgent and necessity of eradicating polio and strongly endorsed the Global Polio Eradication Initiative 2022 to 2026 strategic plan. This strategy aims to overcome remaining hurdles, strengthen the healthcare systems in affected countries, and deliver a polio-free world by 2026. That was 10 of our esteemed scientific colleagues. Since then, 3,200 signatories from 120 countries have now joined them. In short, the declaration reads, we, members of the global scientific community, declare our continued conviction that polio eradication is feasible and urgently needed. On my many quests to get vaccines to every child in the world, I've encountered a myriad of obstacles: apathy, fatigue, failure to keep the energy level high, and remind our contributors of the commitments that we have made and the history that's easily forgotten. A band of anti-vaxxers had me trussed up over a spit, over a hot coals, until I illustrated that they too could help in the polio fight by contributing to the Rotary Foundation's initiatives for safe water and sanitation. Their funds wouldn't go towards immunizations. But because polio is spread primarily through unclean water, we will be fighting the fight together and not against each other. They untied me, let me go, and eventually my hair grew back. The Taliban's distrust of the West kept us from millions of children until they came to power 2 years ago in Afghanistan. They are now managing their own vaccination campaigns, reaching millions of children that we previously had no access to. COVID was a major interruption in polio vaccination campaigns and drained away the resources needed for polio vaccines. Most insidious are the passive aggressives concealing themselves as friends of Rotary, within Rotary, but really scheming to advance their own initiatives and positioning to be Rotary's next major initiative. Now, who would not want to be the next thing that Rotary takes on? However, the distraction weakens our resolve, and without eradication of polio, the next commitment that Rotary makes loses its integrity. How will we garner partners for the next commitment without fulfilling a commitment that we already made? I've had to overcome myths, such as the accusations that we were sterilizing the children. In this case, our success has been our defense. In 2013, India was declared polio-free, and today I am happy to report they are still having children in India. This is not the same old story. Despite oral polio vaccines' incomparable ability to stop the spread of wild polio, we had a rare problem with oral polio vaccine mutating into a more virulent form. The issue is that it is genetically unstable. However, a novel oral polio vaccine, which is 50 to 100 times more stable, was recently developed. In March 2021, the World Health Organization made this vaccine against type 2 polio available for emergency use. Since then, it has been used more than 650 million times. And now in the journal Nature, the researchers have detailed the creation of stable vaccines against polio types 1 and 3. These represent the first new polio vaccines in 50 years. I've survived with a lot of luck, my belief in a polio-free world, and your support. Now is not the time to move to the next thing or to leave the remaining work to others. This will be of great benefit to the world and to this institution. Dr. William Fogarty, the former head of the Centers for Disease Control and the Carter Center, makes a compelling analysis of the correlation between improved healthcare and peace. Ladies and gentlemen, it is quite possible that our role in eradicating polio could lead to global recognition of this institution for its work in the area of peace. A Prix Nobel de la Paix, a Nobel Peace Prize for this institution. Our successful eradication of polio will build our reputation for fulfilling a commitment that we made many years ago. That is a reputation that we can leverage with partners for the next worldwide initiative that we would like to entertain. My point, ladies and gentlemen, is that I've covered about 3,600 years of polio history with you today. Don't you think it's rather amazing that not only could polio be eradicated in your lifetime, but that you could play a substantial role in that? I want to thank you for your past support, and I ask you for your continued funding for global polio eradication, and I stand ready to answer your questions.
Thank you, Professor Jones. we have regents who have questions. I'll first go to Regent Quinn Swanson. Quinn, you have a question for Dr. Jones?
I do. Good morning, Dr. Jones. Thank you for sharing your passion for ending polio and the fight indeed. Can you share with us, please, how much you think this eradication will cost us?
So when I talk about Rotary, this institution, our goal is to raise $50 million per year, which is a drop in the bucket when you consider that the overall effort to immunize all the children in the world is about $1 billion per year. When you take that 50 million and you divide it by 36,000 Rotary clubs in the world, you get about $1,500. That takes us to about 54 million. Excuse me. And why is 50 million our target? Because Bill and Melinda Gates Foundation will match us 2-to-1 up to $100 million. We don't want to leave any of Bill and Melinda Gates money on the table. So that's our target, and that's our request.
Thank you.
Second question, Regent Pastor Stephen.
Dr. Jones, we've been funding since 1985. How much longer are we expected to continue this funding?
It certainly has been a long, long process since our commitment in 1985. Right now, the strategic plan is to have polio eradicated by 2026, just a few years. And it'll probably take 3 to 5 years of testing the environment before we can be assured that polio is completely eradicated from the world. But we have a plan that says that by 2026, polio will be eradicated.
So to clarify, we have to be able to go for no less than 3 years with no wild polio cases in order to make that declaration?
That's correct.
Thank you. Regent Johnson.
Dr. Jones, there are many naysayers using uninformed, uneducational logic saying, hey, there's only 12 cases in the world. What are we still funding this for? What would happen if we don't continue our polio eradication efforts?
Quite simply, it means more paralyzed and killed children from a polio virus is completely eradicatable in the world. You look at the 3,600 years of history and what we've done in the last 35 years, from hundreds of thousands of cases now down last year down to 12 cases in the world. There is nothing else that you can give to where they tell you that the thing that they're working on is going to be done. It seems like every charitable cause that you would consider giving to, they never say that that issue is going to be done and complete at any particular time. Homelessness, fentanyl problems, all, you name it, whatever it is, social ill that is out there. Nobody says by such and such a date, we're going to have the problem solved. This is a unique challenge. Nothing else exists like it. And I've just been so proud to be a part of it and part of Rotary and a part of this initiative. And if we don't do anything, it just simply means we'll have more paralyzed children in the world.
So before we let you go, Dr. Jones, let me throw it out to the audience. Does anyone have any questions that they'd like to ask Dr. Jones? Pete?
Dr. Jones, what is the logistics? I mean, right now we have 12 cases in Afghanistan and Pakistan, but what's to say that we're not going to get another case in Turkmenistan or Kazakhstan? Where do you decide where to distribute the vaccine?
So over the last 35 years, with the implementation of healthcare initiatives in areas that never had it before. Those healthcare initiatives aimed at delivering the polio vaccine have lived on, and they have become disease monitoring stations around the world. And so we're very aware of when there is an issue anywhere in the world with regards to polio and a lot of other diseases. That's part of the health infrastructure that we've built up. And so we know where to concentrate our efforts. But more so than that is that it is necessary to immunize every children. Every new child in the world needs the immunization in order to be protected. So a child in the United States still needs the immunization, even though it's been gone from the United States for quite some time now. There will be a time when it's not recommended anymore. And such is the case. If you look at for instance, Marchadimes has a list of recommended immunizations. Excuse me one second. On that list of immunizations is polio. What's not on that list anymore? Smallpox. Smallpox was eradicated, was the first disease that we eradicated. And so someday we hope that will be the same for polio, that it will no longer be necessary because it doesn't exist anymore.
You raise an important point that, when people ask about the cost, I mean, all children need to be immunized until we are a polio-free world. That's part of the cost. Again, before we close it out, Dr. Bob or Dan, do you have any questions for Dr. Jones?
I'm just being a little flippant here, sir. I see you're wearing a bow tie, and of course, I just realized just a short time ago, I saw this on the back of a truck. I didn't know what the hell it meant. It said bow tie till you die. I realized that are for people who are fans of Chevys. I didn't know that, but I like to see you wearing your bow tie there.
One for Chevy. Dr. Bob, anything?
No questions other than this is a great presentation. I think it's something that should be produced for most Rotarians, just as a great reminder of this push. It's easy to get stagnant on some of these efforts as it seems to get old, but this great presentation, Tim. I really enjoyed it.
Well, one of the reasons we wanted to record it was so it would be available to share, and my hope is that we can actually get it played at district conference.
I really appreciate your efforts. Thank you so much for your attention today.
Thank you. It was a delight. Great job.
Thank you, Dr. Jones.
Well done.
Have Abby, our senior high school advisor, and the